Okay, so we've got Dr. Dapo Alagbe. I've been practicing that pronunciation. How was that?
No, perfect.
That's perfect. What do people normally call you?
Just Dapo. So
Dapo.
just
And how about your patients?
yeah, Dapo as well.
Dapo as well.
Yeah.
All right, fantastic. I've never personally met Dapo, but connected with him over Instagram, over his dental page. And he's a newly qualified dentist, Liverpool, I believe.
Yeah, Liverpool.
Liverpool, I believe. And I believe you graduated with a distinction in oral diseases.
I did.
Yeah.
It's a surprise, but it's nice to see that results there.
And there was also the Knee Healthcare Award.
I knew about this one. I didn't know that's what it was called.
So what was it presented to you as?
It was presented to me as the person that showed the most. How did he even describe it? It was something to do with radiology. So I took the most radiographs, like showed an interest in taking radiographs, just
Yeah.
showed an interest in the radiology department, and actually won
Yeah.
a pair of loops. Yeah, so that's the pair of loops that I won.
So you didn't even know that you're online?
No, I didn't know. I just didn't know that they put it online. I knew that it was that awards because it was a new award, but I didn't even know that they put it online.
Now you know.
What award is it? I didn't even know that.
So looks like you're winning quite a few awards then.
Yeah.
Were you always like that academically?
Academically, you always try your best to try and do a little bit extra and see what you can do. There's no point in just sitting down and doing nothing. You put a little bit of effort in and see what comes out of it. So
yeah,
there.
I think the one thing though, I saw that you're an Arsenal fan.
I am. You can see in the corner. You can see my red and white scarf there.
That was the one thing I was like, nah, this is the one cross against your name that you're an Arsenal fan.
No, got support. We're going through a rocky stage at the moment, but we'll be back. We will be back.
And actually, something came up with you at Arsenal Fan TV as well.
Oh my! So that was my first ever Arsenal game. I went with my friend called Steven. He took me. We won 2-0. Did we win 2? Yeah, we won 2-0 that game. And it was just a thing of I just wanted to see because I've always seen the videos. It's actually my first ever game at a stadium.
Yeah.
So
Emirates.
At the Emirates, yeah. And then I went to see, and then actually was able to get on. And I didn't think they would put me in it. Yeah. And then when I got home, I just got messages that you're on Arsenal Fan TV. Look, and I was just like, I've made it.
That was it.
I've made it.
But so I think what we'll do is we'll go straight into it. If you just let us know, why did you get into dentistry? You know, that's the question that is always asked. Why dentistry?
Okay, so for me, a little bit about my background is I have two parents, both pharmacists. The easy way for me would have been to also follow them into pharmacy. But having like worked in the shops Saturdays after school, I just found out that I just didn't think that it was for me. So then I was speaking to my parents. They helped me get work experience in other pharmacies just to see if that would change my mind. That didn't really change my mind. Got medicine, a work experience. That was interesting. And then just by the off chance, they were just like, try dentistry. Tried it once and just loved it from what I was seeing. So it was just the person that I was shadowing just sold it to me. And then from there, we've got where we are today.
Did you have any other alternative careers that you were thinking of yourself, or was it just there was nothing that was really sticking with you?
Nothing. It would have been dentistry, if not dentistry.
Yeah.
Then pharmacy.
Okay.
That was a 2.
All right. Because when I always think about this question, you know, I always think I don't know if I'd actually have been a dentist if I was to choose again.
You wouldn't.
I think I might have been a music producer, an IT at university. But I still do love dentistry.
Yeah, no, it's a good profession.
What would you do if it wasn't dentistry or pharmacy? If it wasn't a medical?
Footballer. Play for Arsenal. I don't know if I'd make it, but yeah, I'm not sure. Maybe something away from science completely. Maybe like law or something like that.
Okay.
How
come?
Law's interesting. I just find it interesting. Maybe because I like shows like How to Get Away with Murder, like, and TV shows like that. So I'm interested in law as a result.
Yeah, my wife's always watching all those crime dramas.
Love them. And I've got the time at the moment, so.
Apart from dentistry, then like what do you do outside of dentistry? What do you do to relax or for fun? So there's football.
Yeah, football. Friends. Friends
Yeah.
are a big part of it. Family. But it's weird because obviously my friendship groups, I've got a few friendship groups, but it's just weird that in each friendship group there just seems to be a dentist in each of the friendship groups or a medical professional.
Yeah.
So it always comes back to it. So there's sometimes I'm just like, guys, no dentistry talk today at all.
Yeah.
It can't like rule our lives. So it's just a case of making sure you've got that balance and understanding where that balance is for you.
All right. So when you made the decision that it was going to be dentistry, tell us about the process of actually then focusing your mind and saying, okay, let me apply for this. How did that then go for you?
Okay, so then I went through it. So year 12, year 13, you then decide that you want to do dentistry. You need to get your stuff ready. You need to get your application ready. So you go in about looking for work experience, which is actually not even an easy thing in itself. Luckily, my parents know dentists, so they were able to get it for me and help me get that process started. You then look at starting your UCAS application, looking at going to universities, going through that whole process, which is quite daunting when you think about it. When you look back, you've got more exams to try and do at the same time. It's quite a daunting process. Like, and my close friends will know how stressful it was for me at that time.
Do you feel like you had somebody to refer to that took you through the whole process, or did you have to literally find out each step by yourself?
No, we had people that have gone before us in the years ahead. So I went to Dapo Grammar, a school in Kent, and they were quite good at making sure that people ahead of you supported those behind you.
That's good.
And as I said before, like my closest friends, we all applied together. So two of my closest friends are actually dentists as well. So we did, we actually did the whole process together.
Where did they go?
Where did they go for uni?
Yeah.
So one went to Birmingham.
Okay.
And one went to Plymouth.
All right. Okay.
Yeah.
And then in terms of actually getting interviews and then places at dental school, how did that go for you?
Okay, so I just think the whole process is quite tough.
Yeah.
So I actually applied twice, for those of you who don't know. I can't remember what the numbers are, but it's quite competitive to get into dentistry, just because if you compare it to medicine, there's less dental schools in the country. So when you're looking at it, you're gonna find it more hard to get into dental school. So when I applied first in 2013.
Okay.
We applied for 4 dental schools and 1 backup option. Every time my backup option was always pharmacy.
Okay.
I applied in my first year, so 2013. I got 3 rejections and I got 1 interview. That was for the University of Plymouth. I did the interview, thought I did well, and they came back with feedback that I missed the offer by maybe like 0.5.
Oh man.
Yeah, the cut-off was like by 0.5. Called up on results day. I was like, anyway, any chance? Like, obviously, you've got that faith that maybe they might slide you in, but they were just like, no. And then at that point, you're just like, what do you do? Because what is this? This is around February, March time. You've got all rejections. I think by that point, I think pharmacy had taken me, my backup choice. But then you're just there thinking, what do you do? I said to myself, I could either take this pharmacy option. I could go and look at doing a gap year. And then a gap year for me just looked appealing because it would be 1 year out of education. I would then be applying to universities with achieved grades as opposed to predicted grades. Yeah. And I just felt as though that could be my motivation to make sure I did well in my exams. So I went into my exams saying, if I did well in my exams enough to apply again, I'll do that. If I didn't do well enough, then I knew there was no chance and I'd have to look at going in a different route. So my results came out. I got good grades, good enough grades for me to reapply again. So took the year out. I had to explain to my parents, you've got African parents, what are you going to be doing at home for a year? Yeah. All those questions. But I think my parents were quite understanding at what I was looking to do. And I always said, if I didn't get it first time, what's the harm in trying again? So second time round. Yeah. Did it second time round. Same thing again, couple of rejections, but this time I got two offers, two interviews and two offers. So Plymouth interviewed me again, but this time I was more prepared. There was no chance, no way that I was gonna get rejected again. Made sure that everything was on point, and I actually went for Liverpool. Liverpool also offered me a interview and a place as well. So that's how it works. So that's the thing. You just need to make sure that one, you're aware of how difficult it is. Don't let it get you down. And the second thing is just keep trying. If it's what you want to do, just make sure you put all your effort into it.
So Liverpool, I could have actually ended up in Liverpool 2013.
Okay.
So because I applied for the graduate entry and I
Okay,
got
yeah.
Liverpool a new client. So I could have actually been in Liverpool.
Wait, so you would have been, what year would you have started?
It was the 4-year course. So I'd have started 2013. And
Okay,
then
so that we would have kind
2017.
of crossed over a
Yeah.
little bit. Yeah.
Yeah. But no, Liverpool looked good when I did go there. But what was different about the second time of applying rather than the first time? Was your preparation very different, or was it just fine tuning certain things?
In terms of preparation, I made sure that, you know, when you feel something the first time, you go overboard. So I went on courses. I made sure my personal statement was perfect. I made sure there was just nothing. Just made sure it was just watertight and as good as possible. And I always think that when the admissions team are looking at your application, they're always gonna look more highly of somebody that's already achieved their grades, as opposed to someone that's got they're not grades at all, because then they're putting their hopes on somebody that could get the grades, as opposed to someone that's got the grades already. So I felt like that put me on a slight advantage that second time round. And it's also the case with one of my friends, the one that went to Plymouth. We actually did the gap year together, and we both did the same thing. And our second application was actually stronger than our first.
Yeah.
So,
how about the interview? Do you think your interview technique was very different in comparison to your first time around?
I think I was a lot more. The problem with me was the first time round, when they were asking me the questions, I don't think I was answering it correctly, because they kept asking the same question. And in my mind, I should have taken it as, if someone's asking you a question 2 or 3 times, you've not answered it the way that they want to. Then I made sure the second time round that I was answering the questions in a way that they wanted, or just made sure I answered it properly.
And just out of interest, what experience did you had with interviews?
Dentistry-wise?
Time, just generally.
Probably nothing. Probably maybe a mock one that our school had put on, but nothing to that level.
Because that's one thing I always think, you know, how many 17-year-olds have actually like practiced interview technique properly?
Probably not. And it's funny because at Liverpool, they actually put students on the interview panel. So I've been on both sides.
Yeah.
So
same.
in Liverpool, I've actually done the interview panel, and it's interesting because you can see how people are reacting to the questions, how nervous people are. So it's nice when you put yourself in their position, you just calm them down, just say, you'll be fine. Take a deep breath and start with your answers properly.
Yeah, it's an interesting one. So Liverpool, so how was that settling in to Liverpool as a city, as a university? What was that like?
Obviously, for me, when I was picking, so I had Plymouth and Liverpool as options to go to. I just went to the city, and I had a couple of friends from years above me that were also in Liverpool. Also, I had a few friends in Plymouth as well. So I had friends in both cities, so I knew that I wouldn't be alone when I went there as well.
Yeah.
So it was a case of just settling down. When I went there first, it's just a case of finding friends, and it's far from home. It's 2.5 hours on the train, so it's just a case of finding yourself and finding your friends. It just happened organically.
So home is London?
Home is London.
And you're going to the opposite side of the country?
Opposite sides, complete opposite sides.
What's some highlights that you had at Liverpool then?
In Liverpool, I feel like probably the highlights were probably the friends that I made. So I made friends with actually live dentists. Like, those of you listening will just think that all this person knows is dentistry and all his friends are dentists. So like, it was just the way it felt. I met 3 guys, my boys from up north. So they're all up north now. And we lived together for the whole 4 years. So basically in first year, you're put in accommodation, you can't pick.
Okay.
And then from the second to the fifth year, I lived with these three guys, amazing guys, all
Yeah.
dentists, and we just enjoyed ourselves. It's
Yeah.
good because these guys had the right balance of enjoyment and play. So when it was time to enjoy ourselves, we could enjoy it. But when it was in time to revise, yeah, we just everything was locked off.
Yeah.
Everybody knew when it's time to knuckle down.
Yeah. Well, how big was your cohort?
Our cohort was, I'd probably say 70. It was not big at all,
Yeah.
not big. So it was a case of everybody knowing everybody.
Mm.
Um, if somebody wasn't in the lecture, you'd be able to notice because it was that small of a cohort.
Yeah.
And actually, in first year, I think it started off smaller than in second year because I think on that 4 year course, you would have joined in second year.
Yes.
So the cohort would have been about 58-ish, and then probably about 12, 15 grads join in second year. And that makes it to about that 70 figure.
All right.
So
So
yeah, that's how it works.
would you say that there was some similarities between Liverpool dental students? So at UCLan, you had pretty much mature students. They were on their second degree. Some had masters. Some had families. So there was a different vibe to it.
Okay, fine.
And you probably get in another dental school. Was there something that you felt within Liverpool Dental School that was like unique?
No, not. I just feel like everybody was like a family. Everybody was ready to help each other. It
Yeah.
was a case of obviously when I went in so I took a gap year. So then I felt as though when I was going, I was probably going to be the oldest one there.
Yeah.
Going to be dealing with everyone a year younger than me. But then when I got there was people on second degrees, people that had babies, people that had time of education. It was just a real mix of people. So there was no case of people feeling old. It was just, just a good
What,
blend.
what were some things that surprised you about the course?
About the course, I just, the course in itself.
Or things that stood out from the course?
Okay, so what stood out was maybe the PBL style of learning.
Mm-hmm.
Um,
Problem-based learning.
yeah, problem-based learning. I think I'm more of a person. Before I went to uni, I was more of a person that was just like, give me the information, let me go away and read it. But this course
Right.
structure, so this course structure made us go away in small groups and then go away and learn different things about different aspects of maybe the body or a disease, and you actually come up with a lot more information. Because I feel like if you learn it yourself, or if you have to go and look away at the information yourself, then you get a better understanding. Because then if you're able to explain it to somebody else, then you know, oh, I fully grasped it
That's
for my
it.
own information. So then I can go and pass it to someone else. And I feel like it worked a bit better. So just make sure when you're applying to these unis, you just know the course structure and the learning style. So if you're going to have to adapt yourself and learn in a different type of way.
Yeah. So you said you had been on the panel for
Yes.
interviews. So tell us some secrets, man.
So,
How did you get into Liverpool Dental School?
so in terms of getting in, I think just be yourself. Honestly, there's nothing. Liverpool is honestly, when I look back at my interview, some of those interviewers, they're just stern. And then when you actually get into the school,
Yeah.
everybody's just so nice. Honestly, just be yourself, and I feel like your personality will just shine through. It
Yeah.
honestly does. You can see somebody that's trying too hard. You
Yeah.
can see somebody who's prepared too hard. Like you ask them the question, and straight away the answer's there. Like
Yeah.
just let it flow, let it be relaxed. It's honestly, just take it like a conversation. And
So
obviously Liverpool was
would you
MMI
say
as well.
there's anything in particular that Liverpool Dental School look out for? So I know some unis people say it's the UK CAT. I think it's called the UCAT now.
Yeah,
For some unis they say it's your grades. Like, is there anything in particular, or they just look at it in a balanced way? There's no
I think it's a
weighting.
balanced way, and I think most unis now use the UK CAT. When I applied, they didn't use the UK CAT,
Okay.
so it's now changed. I think it's just a general overall process that they look at. Um, it's quite a simple process, but I feel like when I did apply, one of
Mm.
the things that you couldn't apply to Liverpool again is that if you had an interview before and you'd been rejected, so then the second time they wouldn't allow you to be even interviewed. So that was just one thing
Okay.
that I realized that I didn't realize. So make sure when you're applying to these universities, you know what each university wants, because obviously they put those restrictions in for a reason. So they're just going to weed out those people. So just make sure you fall into the category that they're looking for.
Yeah, I think I read recently that Liverpool aren't going to be taking on any more grad entry students.
They're not doing. I didn't
The
even know that.
4-year course is not happening anymore. I think last year, 2019, was the last intake.
Oh wow.
Yeah, so there must be some big changes at the dental
Yeah.
school.
Yeah. Most probably.
Do they train therapists or?
Yeah, we had a hygiene and therapy course that was also there as well when I was there. So
And did you mingle with
yeah,
with the
I think
students as well?
there was like socials. The common room was quite a good place for us to mingle. So it was just a case of just finding those people and just
Yeah,
intermingling. It's Liverpool. Liverpool is just just a nice city. Everybody's so friendly. That's one thing that I do miss. London, everyone's out for themselves.
yeah,
Like going straight, nobody's talking to you. Headphones in. In Liverpool, you lost. Oh, how can I help you? You're right
yeah.
there. What's up?
Had you ever been to Liverpool before? Or was that your first experience of Liverpool?
Have I been to Liverpool? Apart from my interview, no. That was my
No.
first. No.
So that was similar for me. I'd never been to Preston before my
Okay.
interview.
Preston's not even far from Liverpool.
No, yeah, we come there. Me and my wife would just take a trip there. We like the docks. City centre's quite
Yeah.
nice. Yeah, it's a nice place, Liverpool.
It's nice.
Yeah, but I can't see myself going back down south.
Oh, see, I don't think I could go back up north. It's nice, but home is where the heart is.
Yeah.
Yeah, I don't know. I don't. And you can never say never, but you can never say never, but I don't know.
All right, all right. So okay, talk to us about you're now getting to the end of dental school, and you're deciding on the next steps.
Okay.
So foundation training is one thing that you start to
Yeah.
think about. So tell us about that process. What was it like now applying for foundation training?
Foundation training. Okay, so foundation training is the 1 year that you have to do post qualification
Mm.
of dental school. So you do 5 years in dental school, and then you need to do your 1 year post qualification, which is called your foundation training. I think previously known as VT year or vocational training. It's just a year where you're under the guidance of your educational supervisor. So it's just like a tutor, but it's a tutor that's one-on-one.
Yeah.
So there's somebody that you can call in whenever you wanted, or you're stuck, or somebody that just provided you with advice throughout the whole year. So the process is quite a simple one. So you go through a national system. There's two parts to it. We did a situational judgment test, so SJT. So for those of you that have done your theory, it's just in exactly the same center like that. And they will give you like a situation, and you have like options A to E, and you need to rank them from A to E, which one you think were best to worst. And from there, you get a score. And then added to that, the second part is an interview. So the interview is comprised of, it was two parts. So you get two scenarios, and what you had to do is you had to discuss how you would deal with the situation if you were a foundation dentist. And there was a panel of 3 people, and they would just judge your score. And then from there, you would get an overall score. And then from that overall score, you will then get a ranking. So then you're ranked in the whole country. So every single final year dentist will do that from every single dental school. And then you're ranked. Upon your ranking, that will then decide where you then get a job for your foundation training year.
Yeah.
So what you do, the country is split up into multiple like deaneries or sections, and then from there you rank the different sections. So say for me, you put London, Kent, Surrey, Sussex as first, Kent, Surrey, Sussex East as second. You then go from there, and then you see where you get ranked, and then you put them first, second, and third, and then the higher you ranking, the more likely you are to get your preference of choice in, if that makes sense.
What was the preparation like? So I'm guessing this is in your final year.
Yeah, so hard. We had
Yeah.
mock going on, had everything going on. You had patients that you wanted to finish. So it's probably, if not as stressful as applying, probably more stressful, because the preparation was like, it's like another interview again. So you had to get interview processes done. You had to look at SJT books, looking at those books, seeing how people answer the questions, seeing what the correct way to do things, seeing what laws and ethics could come up, seeing what guidelines you need to even look at. But it's a thing like, as I was saying, the people I lived with those three guys. It was just a house that was literally constantly doing interview panels. So there was four of us. One person would be interviewed, and the other three would be the interview panel, and it would just bounce off each other and give each other advice on
Yeah.
what was good, what was bad, what we would do differently, which is good because they can understand where I'm coming from. If they understand I'm having a bad day, had a bad day on clinic, they can understand what's going on, why this guy's not happy today, and we could just bounce off each other. So it was good.
Where did you do the interviews? So where was the location?
Bolton. So
Bolton.
yeah, it wasn't in Liverpool.
The stadium.
The stadium, yeah, Macron
Yeah.
Stadium.
Reebok. Well, Macron. It's called the
Macron,
Macron.
yeah, the Macron. So we had to travel there.
Yeah.
We think we were given a time. We were given a time, and then from there we did interviews. So we actually stayed in a hotel
Okay.
closer to Bolton because it was a fair distance from Liverpool to Bolton. You could have gone in the morning, but we just didn't want to take the risk of train delay, anything like that.
Yeah.
That would just add to the stress. So we just stayed in a hotel close to the stadium that we could actually walk to the interview, and I just put your mind at ease.
So for us, we were actually going to do it at Bolton, and for some reason they changed it to, I think it's Haydock Racecourse.
Okay.
But then I went on a training course that was actually doing the training at the Bolton stadium. So
yeah, I did the same thing. So I did a training course maybe a month and a half before the actual thing. So that was good to see.
The DTC, Dental Training Consultants.
Yeah,
I thought that was very good.
Yeah, it was. It was very, very good. And the thing is, when you get to this stage, you're just like, do you do this course? Do you not do this course? But you're just like, you feel like you're at a disadvantage if you don't do the course. It's not something you can do again. It's not like when I was first applying that I could do it over and over again. This is just 1 year, one chance to do it. So you just spend the money, close your eyes, forget about it.
Yeah.
And even if you learn one thing is better than nothing.
Yeah.
So it's good.
Did you find that you really looked into the area that you were applying for in terms of the type of practices in that area, or was it just more about being close to home?
Coming home, because I feel like
that was it.
I could come home, and then after that, because we didn't get the practices before we applied, we just got applied to the areas first, and then after that we looked at the practices. So I didn't know nothing about the practices until maybe about June time.
Okay. So do you remember the time of events, from interviews to finding out to actually, do you still remember?
No, it was interviews. No, not even. No. It's only a year ago. What's wrong with my memory?
But okay, in terms of actually now getting to pick the areas within London, or the practices within London, do you remember when that was?
So that was before grad. So grad was in July. So it would have been before July. So around June time.
Around June
time. Yeah.
Yeah. And do they have a profile of each place, or did you meet the?
We actually met.
Okay.
So it was like a speed dating, 5 minute, not 5 minutes, because we could spend however long you wanted with one person, or you didn't. So we just went around each person, asked the questions that you wanted to ask, and went from there, really.
What questions were you asking? What were they asking you?
I didn't even know what to ask. Like, I was just like, so actually I've got a group chat with the guys that I lived with, and we just said, what questions would we ask? Because I don't think those guys had a meet and greet. So I just put in the group chat, what questions would you ask, guys? They were like, what rotary system do you use? Would you have a nurse that was consistent all the time? What are the working hours? How easy to book off holiday? I'm quite an easygoing guy, so stuff like that. I think the only thing for me was just root canal, the rotary system, because we were taught with wave 1 system in uni, so it's just a case of, would I have to learn another system, or would it be exactly the same as what I've known?
I think the questions are similar across the board, because those are the same questions we were asking as well, but we didn't do the speed dating setup. Ours was more, each trainer comes in, gives a presentation, next one comes in, gives a presentation, and then you just choose what you wanted to do.
No, even where I am now, when I went to this speed dating thing, I was of the mindset of let's get close to home. The closest one to home is the one that I want. But then after speaking to them, I just felt like the one that closest to home, because you need to remember you're going to be in close proximity to this person for a whole year. You need to be able to get on with them. You need to be able to tell them that if you've got a problem. I just felt that when I was choosing, the ones that were closest to home weren't the best fit for me. So I just took away the proximity thing, and I just looked at where would I pick from my house, from that list essentially.
Okay.
And where I am now is 20 minutes from my house.
That's still close.
Yeah, very close. And
Yeah.
the traffic is away from London. So the motorway is literally just mostly clear. I think I've been late to work once
Yeah.
since I started. But the thing is with that is that everyone that works with me comes from the same direction.
Yeah.
So if I'm late, everyone's late. So if I'm late and no one else is late, they'll be like, we all travel on the same road. Why were you late?
Yeah.
So we were all late that one day. So
did the principal have any, the trainer, did they have any choice in who they got? The decision was all with yourselves.
all with ourselves. All with ourselves. But the trainers get no say at all. It's all within ourselves. But then the thing is, the ranking again is based on where you ranked the first time. So say you and your friend say I ranked top 10 and he ranked 20. If you both pick the same practice, the person that got 10 will pick first, and it will just go on.
So the ranking from your final year in dental school determined the area in the country, and then that same ranking helped you choose which practice and get priority for a certain practice.
Yeah. So it's quite important. So that's why it was a big thing. But even when we were looking at it, me and my friends that lived together, we were more scared about that as opposed to finals, because I feel like finals, there's only so much you can do. We've got a lot of control over what's going on. Like we revise. If you don't revise and it comes up, that's kind of your fault. But we felt as though this was kind of out of our control.
Yeah.
But luckily we all got home, so it was nice.
Anything that you would say would help somebody with the interviews for the recruitment process for dental foundation training?
I'd say go on the courses. Get a good group of friends that would be willing to help you practice. Actually saying that, get a group of friends that aren't your friends, if that makes sense. So practice with a group of friends that aren't your friends, because essentially that's also something else that we did, because if you practice with your friends all the time, they're more likely not to say, oh, it was bad.
They'll give you a pass.
Yeah. So if you practice with people you don't usually talk to or aren't really communicating with all the time, they'll be like, they're more likely to give you better advice, if that makes sense.
Yeah.
So do it with different people. That's something else that we also did as well. And then you can bring that information that you learned from somewhere else and tell it to your friends. And then that's just the way that's how Liverpool just made one big ball of connections. And I feel like that's how our year, we actually got a white glove year. So that means everybody passed.
All right.
Yeah. Final. So no one failed. So I feel like that was a big part in our dental school journey as a team.
So tell me a bit about how the your first few days, weeks were on the dental foundation training. Yeah, so getting to know the staff, the nurse,
So the first couple of days weren't too bad, because actually the type of bond that me and my trainer had made, it was just a case of that we made such a good bond that he's actually telling me to come in before actually started. So we started in September the 1st. He knew how close I lived to the practice. So he was just like, come down in the summer when you have a couple of free days and just come and see it and just get to know everybody. So it wasn't a big shock when I went in September. I knew everybody's name. Everybody knew my name. It wasn't that big of a deal. It was just a case of getting into it when you started. So obviously my room was just freshly built for the foundation dentist. So just a case of making sure I knew where everything was. It was pretty much all right. Because obviously in the first month, we aren't allowed to see any patients at all.
Okay.
So there was more study days, more induction, getting to know the staff, getting to know the fire exits, all health and safety issues. So that was what was involved in the first month. And then in the second month, that's when you now start seeing patients.
Okay. So I think you introduced, did you have the e-portfolio?
Yes, we still have it.
Yeah, that thing, man. Yeah, so tell us what the e-portfolio is.
So the e-portfolio is a system where it just allows you to reflect a lot on what you do during the week say something goes wrong, you can reflect on that. It allows you to put your numbers in. So just a big database of everything you've done in the year. I was used to it because I feel like Liverpool set you up for that, because Liverpool
Okay.
knew what was going to come in dental foundation training year. So they got us reflecting a lot. We had a system which was called Lift Up, which gathered all our data so you could see how many crowns you've done, how many fillings you've done, how many dentures you've done. So it wasn't too much of a big jump for me, because Liverpool, I feel, had set us up for that. But it's just a big database where you can reflect constantly and see how your progress goes throughout the year.
Gosh. Okay. So you said you were getting your whereabouts and where things were in the first month, pretty much admin stuff.
Yeah.
During the first month, and then second month you started getting to see some patients. So I guess one of the fears is my book going to be too filled? Am I going to be quick enough to handle all the patients before you start? So what was that like for you, and the reality of it?
So for me, I feel like at the start, my education supervisor and reception team were booking in patients maybe an hour for an exam. And obviously at the start, it's just exams. So like an hour for exams. Just a case of doing full treatment plans from start to finish.
Yeah.
And it was okay. You get back into the swing of it, because you need to remember that. So for me, I finished my last patient maybe March was my last patient. And then
At dental school?
At dental school.
Yeah.
It's probably March. Finish all my patients, and then October is the next time I've seen a patient. So you kind of forget things. So the hours, that was good. It just, the rust comes off, but everything comes back.
Yeah.
It's like riding a bike. Like you never forget. You never forget.
Did you have a concern about maybe having a different nurse each time, or was that actually a reality, or did that make a difference when you started?
No, my nurse is pretty consistent. Like she's probably been off 2 days since I started, and it's probably because she's sick.
Yeah.
But even when she wasn't in, I feel like the team that I have where I'm working at the moment is pretty good, so that it can interchange quite quickly, and got no problem with working. I feel like that's something that you need as a dentist. You need to be able to work with different people. That one nurse isn't going to work with you your whole career, so you need to be able to change it up pretty quickly. So it's pretty good. It's not too bad.
Well, what was the main difference in terms of treating patients in dental school, and now you're in your surgery and you're controlling that environment? What was the main difference?
That's the thing. That word control. You've got probably more control in terms of doing what you want, but that's legal and ethically correct. But yeah, you've got a lot more control. Dental school, say you're doing a fill-in, you have to create a cavity prep, then you have to get in the queue to go and see a tutor. And that queue could take you maybe 30 minutes to get out, because obviously there's other students as well want to see the tutor. Then you're asking them, is it okay? They say it's okay. Can you fill it? You get back in the queue, is it okay for the patient to go? So it's just a long line of patients, or long line of things that could be done in a shorter amount of time. So maybe there was one time I must have done a root canal maybe in an hour. And I was just thinking, from start to finish, I was thinking, in dental school, there was literally no way I could have done that without getting in trouble. Like, I could have done it start to finish, but obviously you're going to get in trouble, because they're going to be like, you didn't show me the steps. So if you know what you're doing and you know it's right, you can just quickly get it done.
Are there any things that you I don't want to say learned properly or became more confident? So for myself, it's only when I got to my foundation training year that I realized I didn't know what I was doing with dentures. And it was only as I was getting to the end of it, I was like, okay, I think I get how this denture works. These steps, I can now do them more confidently, and I can anticipate what I'm expecting back and what the result's going to be. It became more alive to me after foundation training. But before that, it was a whole load of theory and concepts that I just didn't put together.
No, so for me, well, I love dentures, so I don't mind. I feel like I don't do as many dentures as I used to do in uni. I feel like I just kept asking them to give me denture patients. I feel like that might be something that I do in the future, look at doing that. But I feel like for me, maybe extractions.
Yeah.
I feel like extractions were a rude awakening when you're there for 45 minutes, just there sweating, like to my nurse, open the window. I can't, this thing is just taking too long to come out. But I
Yeah.
feel as though maybe just I've learned using luxators, elevators, they do most of the work for you, and then you get your
Mm.
forceps on the tooth,
Yeah.
and it works. So they're pretty good, but yeah, a rude awakening. I just feel like dental school is just a bubble. You
Yeah.
come out to the real world, and it's
That's
just
it.
it's
How have you found communicating and relating to the patients?
communication is okay. I don't mind um, communicating. You obviously you get good patients, you get patients that don't want to listen, but just a case of just talking to them in a manner that they'll understand. I think the one thing that most people will then look at, like, or don't know about that, is money.
Mm-hmm.
In dental school, everything is free. Patients come there knowing that treatment is free. Um, they just sign up knowing that the treatment might take a little bit longer because obviously those stages that I was talking about, having
Yeah.
to get taught by a tutor, it works a lot slower than normal treatment. So then when you're now asking somebody to now pay £270-ish for band 3 treatment,
Yeah.
and you're just like, how do I tell them that they need this? And they, because you've not done it before,
Yeah.
literally you've never done it before. How do you go about that? But essentially is what they need. So you just need to say, you need this treatment, here are your options. Do you want to go ahead with it? This is how much it costs.
Mm.
I'm not taking anything from that. It's literally the NHS has told us to pay or charge you that. So happy to pay yes or no. It
Yeah.
just comes.
Yeah. That's a big part. Actually, being
Mm,
able to talk to patients about the cost of things and just being
mm,
upfront with that. But you do get your own routine for
yeah,
doing.
you do.
You know, you do get your own routine. Are there any of the things that you feel like you've really improved on since starting the training year?
Improved on. Probably, let's think about this. Maybe skills in treating children. Didn't really
Okay.
do that as much. Do that as much in terms of in dental school. We did a little bit. Maybe I don't know if you know what a stainless steel crown is.
Yeah.
Yeah, hall crown.
Oh,
So
yeah.
yeah, hall technique. So doing that has improved. Obviously, my trainer, he's not old. He's just never done it before. So obviously, it's a case of there's targets that we need to do in this foundation year. So there was a certain number that we had to do.
Yeah.
Um, and it was just a case of him not knowing what it was. So then I had to go back and explain it to him, what it was and how it worked. And it was a case because then he's also learning. Probably
Mm.
won't do one, but he was also learning as well
Yeah.
from what I've taught him. But it was interesting because when I was starting, there was actually an associate that was 2 years above me, also went to Liverpool, and she also ended up working where I'm working. So
Yeah.
that's somebody that um, is in that practice. So if I had a problem with a hall crown, it's not as though I'm stuck because my
Mm.
supervisor's never done it before. There's
Yeah.
other people in the practice that could have helped me do it.
Yeah.
So it's just a case of there's always, if someone doesn't know, if one person doesn't know the answer, there's other people within that situation that will know the answer.
What's that feeling like when you got the patient and they're looking at you and looking to you as the dentist and not the
What's the
dental
picture like?
student?
No, what's the feeling like?
Yeah.
You just take, yeah, like I don't get anybody to call me Dr. Dapo. I just say my name's Dapo. Like literally, it's just a simple conversation. I feel like the only people that call me doctor are my parents. I feel like they're just so proud. So they're the only people like they're like, "How you doing, doctor?" I'm like, I was a Dapo before this, so it's just like a normal conversation.
Yeah. And how about with your dental nurse and with the other dentists? What's that relationship like? How was it at the start and how's that developed?
So the dentists that I work with, they're all quite young. So I feel like they've understood where I'm coming from. They've all done it before.
Yeah.
They were always there to help. As I was saying, there's always someone there with the answer.
Yeah.
If one person's specialty isn't, if I've got a question that isn't someone's specialty, they'll direct me to somebody else that enjoys that subject. So it's
Mm.
just a good environment. I feel like the work environment was good, and that's why I enjoy going to work. Because I feel like if you don't enjoy it, then you
Yeah.
wake up like, oh, another day here.
Yeah.
So it just makes it easier, a lot easier.
Yeah. And would you say the reason why you got into dentistry, that's still the reason why you enjoy dentistry?
Yeah, I say that's still the same reason. It was just an enjoyable thing that I could see to help people
Mm.
improve their smiles, and it's still something that I could do today, and I'm still enjoying it.
Yeah. What are the next steps?
We don't know yet. We're waiting to see.
Yeah.
We could
What are your ideal next steps? What things do you want to get into or look into? You know, have you
probably,
thought about that?
yeah, you kind of see it. The one thing that I'd say is that this year, don't shy away from doing stuff that you don't like. So for me, me and Endo, we're not mates. I'm just not a fan, especially Mola Endo. Yeah, we don't really get on. But the only one thing is, try not to shy away from doing it. This is the year to make mistakes. So
Mm.
if you get that Mola Endo that you think it looks difficult, just give it a go. You can make mistakes this year. So
Yeah.
maybe look into further training in terms of endo. As I was saying, I like dentures, so maybe looking to fix removable pros, like a master's or something in that.
Mm-hmm.
I'll see that. Maybe go back into teaching. You never know what route. I feel like dentistry is a profession that allows you to go into different avenues, so it's not a simple. I don't
Yeah.
think I could do
For
5 days.
yourself, it's not, because I know for some people it's almost set in stone. I'm going to go and specialize in this. For some
Yeah.
people, it's I want to do general dentistry and I
Mm,
want to own a practice in the future. You know, for some people, it's I want to get into academia and teaching and public
mm.
health, or you know, for you, are you still keeping things pretty
Just open.
open?
Yeah, just keep it open and see where life takes us, and then just see what avenues become. You might just find out this year that there's one thing that I like a lot more and want to pursue that. So we just see where that takes me.
That takes you. I think one of the things that came almost by surprise was my first GDC payment for the retention fee.
Wow.
As a
But
student, did you see that coming?
no, yeah, no. So basically, I don't know if it worked the same for you. So we had one that we had to pay from July to December. So my parents luckily paid that one for me because I didn't know where I was going to pay that one. And then in December, I had to pay.
So
So
it's about £500.
yeah, it's like
You
500.
pay. You haven't even started working. You
But
haven't
you're
even
still a
started the
student.
payment.
You're still a student, and they ask you for £500. So I just call my parents. Yeah, there's money that needs to come out. Um, so they pay that one for me. But then in December, we had to pay for the full year,
Yeah.
and then there's no picking up the phone. Mom, can you pay this for me? Because they're like, we're working now, so you pay yourself. So yeah, I think that was about almost close to £1,000.
970, something like that.
Yeah, just to be on the register.
Yeah. So this is just on the register to be called a dentist.
Yeah, you need that
And
to
then
work.
indemnity, it'll be cheap for you so far, but
Yeah, is it
I
10 per
think
card?
from next summertime onwards, it'll start picking up.
Yeah, I'm not looking forward to it. It's just a lot of money. Then obviously, if you look to specialize in that, if you do implants, if you do other things, there
Skyrocket,
increases.
skyrockets. Yeah, but that's one thing that I've realized as well, that in dentistry, that um, most things that have the name dentistry or dentist attached to them, the price
Goes up. Yeah, definitely. It's like
gets
whenever you say to somebody, "Oh, I'm having a party," "Oh, is it a wedding?" Yeah, price goes up. So literally, literally the same thing.
Yeah. So, are there any courses actually that you've been looking at, or
Of course, probably
it's still too
Invisalign.
early?
Invisalign. I feel like Invisalign is something that everybody wants, or everybody's looking at straight teeth at the moment. So
Yeah.
it's just a case of maybe looking at, and it looks interesting. I don't know anyone personally that's done it, but I've seen people in the practice who have come back and had it done, and it just looks pretty interesting. So that's probably one thing that I probably will look to do next year.
Invisalign was a game changer for me, to be honest.
Oh, is it? Okay.
Yeah, it's game changer. So my principal, my trainer, he did Invisalign Go. So there's different levels of Invisalign. So he did Invisalign for anterior teeth,
Okay.
and I saw him treating some patients with it. He would show me the process, the treatment plan for it, and that was my first exposure ever to Invisalign during my foundation training year. So actually, what I then did was I asked him to pay for me to go on the course.
Okay.
Yeah. So he owns the practice with his wife.
Okay.
And so he's like, okay, let me chat to my wife and we'll get back to you. So he was like, yeah, I've had a conversation with her. We can't quite pay for the whole thing. We'll put 50% if you
Okay, that's
put
fine.
50%. So I was like, okay, that's cool. Let's do it. So I actually got to do my first Invisalign cases during foundation year.
Oh wow.
And that was really good because, of course, you can book out as much time as you need.
Yeah.
Um, you're not going to get paid any extra. That's going to go to the practice.
Yeah,
But
yeah,
for me, it was just about getting used to the
yeah.
system.
It's a
So
good
that
time to do it.
when I got into an associate position, it wasn't trying to learn something new.
Mm.
You could just lift off from there. So definitely that's something to look into because it really opens up the scope of work you can do.
Pretty good, to be fair.
Definitely recommend it. But actually, what advice would you give to aspiring dentists as we bring this to a close? Aspiring dentists, then we'll do dental students, then we'll do people that are approaching dental foundation training. So let's start with aspiring dentists.
Aspiring dentist, I would say, just try and get as much experience as you can. Getting different experiences within the dental field. Um, just keep your mind open. You might go to one practice and you just think that they don't like it.
Mm.
You might just go and see somebody who's having a bad day. So just do different practices because you don't want that one person to then put you off what your potential profession could have been. So try and get different work experiences. I know it's hard. Um, just keep sending those emails. Somebody will take you eventually. So just keep that and just keep your head down.
What would make you take on somebody for work experience?
Oh, see, I know the struggle, so I know how hard it is. So I'll just say to everyone, I'm different. But I just don't know. So I feel like some people will be like, oh, there's no space, there's no time for it. Maybe look at to apply in your, what do you call them, half terms. Because
Okay.
I know if somebody that's applying to a practice in half term, you will know as a principal, oh, this person just doesn't want to sit at home on a PlayStation. They're looking to do something with their time.
Mm.
So they might more likely look at you and say, yes, let's take this person. But I
Yeah.
feel like most people will say yes. It's just a case of looking and just give them a note and say, if you can't do it now, give me a time that you can do it. I'm more than happy to do it at a different time. It doesn't
Yeah.
have to be straight away.
Okay. Any other tips for aspiring dentists? So work experience.
Work experience, just work as hard as you can.
Yeah.
You know you're going to need those grades. So once you know you want to do it, just put your head down in those books and get it started. And also maybe just start a personal statement. Just get those little things ready. Do those little things. So maybe just put yourself, do those little things that will put your personal statement above everyone else's. So
Mhm.
maybe read some dental articles, get yourself seen in the dental world, and then it will fall into place.
Yeah. And then how about dental students?
Dental students just take the most of any opportunities that
Mm.
come to you.
So what sorts of opportunities?
Opportunities, so get yourself in dental articles or dental magazines. So one for me, everyone knows me is I love a denture. So one of the cases that I actually took on in my third or fourth year
Yeah.
was a case of a flabby ridge. So it's just a dental case of where the anterior ridge becomes a little bit flabby, and they're just harder to create stable dentures for
Mm.
those type of patients. So what I did is I went. It's actually not taught at undergrad level properly. So then, with a couple of my tutors, I then looked at doing special techniques to help create a denture for this patient, and then it actually works. So I use a special window technique and a
Yeah.
little bit of special material for that, and then it helped create a good denture. And then from then, I took pictures along the way,
Mm.
and then from there, I was just like, let's write a case on it, and we'll see where this goes. And it's actually published in a magazine. So
Young dentists, I think.
yes, the Young Dentist. So
Yeah.
it was published a couple of years ago, and that was just something a little bit extra.
Yeah.
That
So did you initiate that?
in
To
terms
use
of
that technique?
the window technique.
Yeah.
What do you mean?
Initiate in terms of, did you say, to your teachers, can we try this technique that I've read
Yeah,
about?
so the
Or,
patient's complaint was obviously she'd had multiple dentures that were not working. So when we did our assessment, I noticed that she had an anterior flabby ridge. Went away and researched it, and I saw
okay.
that there was different techniques. So as opposed to a normal special tray, we could look at doing a window special tray. Looking at that, and then I just spoke to my tutors about it. We
Mm.
have a specialist. We had a specialist in pros, Dr. Tony Preston and Dr. Phil Smith. So we both looked at them, we spoke to them, and I just said to them, would this be something that would be feasible as an undergraduate? and they were like, yeah, they were willing to help me go through the process. Spoke to the
Fantastic.
lab technician. Yeah, we had an on-site lab in Liverpool as well. Spoke to them. I was like, this is the case. We've got a flabby ridge. Would it be okay for you to help me make a special tray with a window in it? They were like, fine. From there, just went on and it worked. So it was pretty good. Patient was happy.
And then did you know you were going to submit it?
No, it was a case of just taking pictures for my own personal portfolio,
Yeah.
and just to also get an experience with the camera. You can see the pictures. The pictures I have were terrible. Like, it's just a case of making sure you improve the picture process. So for me, it was just a case of trying to improve my picture taking skills. And then when I had a case, I was just like, why not? Let's write something. Wrote to the editor of the magazine, and she said, yeah, it's an interesting case. We're looking for people to write. They're always looking for new cases. So just write to them, see if they're interested. If they're interested, you then create the piece.
Yeah. So for me, that screams out initiative, because naturally you'd think that a competition comes up and then you apply to the competition and then you look for a case and then but then it seems like you actually were looking to just take an opportunity that didn't necessarily lead to being published.
Yeah.
And things developed.
Yeah, it was pretty good. And obviously, I like denture, so it was a pretty good case to work on. Quite proud of that one. That was a good one.
What other things would you say to dental students who are trying to make the most of dental school?
Get involved. It's 5 years. If I could go back right now, I'd go back like that, honestly. I think I got a message from one of my friends that we were just talking about finals dinner. It goes by so quickly. It's a case of you get out what you make of it. If I didn't live with those three guys, would I have had as much as fun as I did? Probably not. Like, just immerse yourself in the culture of a dental school. It's a place where there's always something to do. There's always socials. There's always somebody in a similar position to you. So just embrace it. It's 5 years. You think it's a long time. It's not. It's not a long time at all.
Yeah.
It goes by so quickly.
Gosh, okay. And then for people that are going to be starting dental foundation training, what would you say?
Just ask your questions. Have your questions ready. Your educational supervisor is there to answer your questions for you. They might challenge.
Have your questions ready.
Yeah, have your in terms of just like if there's certain things that you want to do within the year, or there's certain things that you haven't done. So I know in Liverpool we had a portfolio of things that we had done. So like molar endos, you've probably done a couple. Or if there's just certain things that you've not done enough of, this is the year for your educational supervisor to help you try and find those type of patients. So then you can try and build up the experience. And as I was saying, don't run away from things that you feel as though were hard for you. So just try and do them. It will be hard, but practice makes perfect.
That's it. Well, no, thank you for your time.
It's been a pleasure.
Dr. Alagbe. Hopefully we can get him supporting a better football team.
No, forever. Wait, who do you support? Man United. I knew it. There we go. There we go.